Our emphasis, as we've been doing this, is we want to protect the children. And we believe that parents know best, and that this should be parent-led sex ed. And we're accused, as a matter of fact, I was looking in the Omaha World Herald at this article that just came out today, and it says, this is Marion Fay on the OPS school board, that she claims that we're loud, we're not effective, and we're certainly not accurate, according to her. It's too bad, again, that she is not here to set us all straight, I guess. But it's interesting, your choice of words, too, isn't it? We believe we're passionate. She calls us loud, we're passionate, because our children are important. And you notice, if you notice my quote in there, because they keep asking me, well, you don't even live in OPS. What's this to you? It's like, what, I can't care about all the children? I can only care about the children in Millard? Or I can only care about my own, well, I do care about my own grandchildren, but I care about all the children, because all the children in this country, they are our future for all of us. And so we better all be caring about them and not try to be divisive in saying that, you know, you can only have a voice, you can only care about the children in the district in which you live. I do want to quickly move to Dr. Grossman. I want to point out, we do have some literature. Dr. Grossman's books are over there. You will all, at some point, get handouts with an action plan of what you should be doing when you leave here today. And so make sure you take that with you. You will be distributing, if you don't already have them already, an index card. So if you have any questions for Dr. Grossman, you can write it on the card, and we will collect those as we get towards the end of her presentation. And I think without further ado, I'm going to ask Dave Meyer to come and introduce Dr. Grossman.
Thank you, Morris. Thank you so much for taking time out of your busy day on a Sunday to join us today. It is with great pleasure that I have the privilege to introduce Dr. Grossman. Dr. Grossman is a practicing physician and speaker and the author of 4 books. She is known internationally for her courage in breaking ranks and calling foul on the sexuality education industry. She has been on over 200 radio, media, news, and television shows, and has provided expert testimony in several state legislatures, as well as internationally. She's lectured at the British House of Lords and has had the privilege to also lecture at the United Nations. Her work is so well respected that it's actually translated in 10 different languages. She speaks to a broad range of audience, from parents to students, educators, policymakers, and health professionals on the importance of childhood innocence and the dangers of a powerful sex education lobby that promotes sexual license instead of sexual health. And that's really what we've been trying to expose over the course of the last several months. She's very well credentialed. She graduated with honors from Bryn Mawr College and from New York University Medical School. She completed an internship in pediatrics at Beth Israel Hospital in New York City and a residency in psychiatry at North Shore University Hospital, Cornell University Medical College. That was followed by a fellowship in child and adolescent psychiatry at the same institution. Dr. Grossman is a board certified in psychiatry and in the subspecialty of child and adolescent psychiatry. You can rest assured what she has to share is from experience, from integrity, and purely from expertise. Will you help me join in welcoming Dr. Miriam Grossman?
Hi, everyone. Good afternoon. This is very exciting for me. Number one, I've never been in 0-degree temperature. And number two, I think the last time that I said the Pledge of Allegiance was probably in 8th grade. I'm sorry to report that. I don't think that at the high school I went to, we said it. I may be wrong, but anyway, it's been a really long time, and it felt great saying the Pledge of Allegiance, and I remembered every word. So thank you for being here. I know it's a holiday weekend. There's a lot going on in your lives you could be busy with. I don't know whether there's a Blue Jay game or Huskers. Is that what your teams are called, right? There might be a big game this afternoon, whatever. You could have been shopping or whatever it is that you'd like to do. I appreciate your being here. I also want to say hi, the Spanish speakers. So I can say like hola, like right into that. Yeah, but they're seeing me through that camera there? Oh, that camera, okay. So buenos dias, hola. Y muchas gracias for coming here today. That's the best I can do. Okay, I was told very firmly not to thank anyone by name. And that goes against how I was raised and what my parents told me, but I'm going to be a good girl, and I'm going to do what Maris Bentley told me to do, and I'm not going to thank anybody. When I graduated from medical school, I took an oath. I stood up, I raised my right hand, and I swore to prevent disease whenever I could. At the moment, I believed that the battles that lay ahead of me would be the fight against cancer, heart disease, mental illness. But after 3 decades and thousands of hours with young patients in distress, I discovered that my most challenging fight is not against dangerous diseases, but against dangerous ideas. Ideas such as sexual behavior in adolescence can be healthy and developmentally appropriate. Every person, male or female, young or old, gay or straight, faces the same risk of being infected with an STD. Condoms provide an acceptable degree of protection from disease and pregnancy. And finally, gender is not related to biology. In addition to being male or female, people can be both or neither. These ideas are at the foundation of so-called comprehensive sexuality education, and they are found throughout the draft here, the OPS draft that was put out last week that I have reviewed. I've been told that of the 9 members of the OPS board, 5 or 6 of them support it without reservation. As a physician who has worked with children and adolescents for 30 years, this is very troubling. I'm here to explain why, from a health perspective, the sex ed portion of this draft must be rejected. Not only does comprehensive sexuality education go against the moral fabric of most societies, what it teaches young people is not scientifically accurate. It's not true. As a physician, I have one objective, and that is to keep people out of the offices of doctors and therapists. I'm going to demonstrate today how comprehensive sexuality education makes my job more difficult. So I reviewed the draft, and I want to say, first of all, it's not all bad. Don't get me wrong. There's some very good material here. There's good stuff about refusal skills, goals and decision-making, use of drugs and alcohol, and the importance of hard work and hope. That stuff is right on mark. However, the portions of the draft related to sexual health are flawed. They are deeply flawed. We only have the bare bones here in this draft. This is like an outline. So there are many, many unknowns about how this will later on be be filled in if it passes. But I see enough in the draft to be able to tell you with confidence that if OPS adopts a sex ed program based on this draft, your children are going to be misinformed. They will have a false sense of security about the risks involved of being sexually active in today's world. They will lack critical information that they need to preserve their health, their emotional well-being, their fertility, and yes, even their lives. So I believe that if the draft is passed, Omaha students will be endangered. I know that that's a strong statement, but trust me, I've done years of research on this topic, and I've given it lots of thought and deliberation. I want you to understand that the priority of the sex ed industry that creates comprehensive sexuality in, programs is not sexual health. Is not sexual health, it's sexual freedom. And you can't have it both ways. When sexual freedom is the priority, then sexual health is going to suffer. And that's not something that's up for debate. Early sexual activity, multiple partners, experimenting and exploring different lifestyles, these are high-risk behaviors even when a condom is used. Nonetheless, the goal of comprehensive sexuality education is for students to be open to just about any type of sexual activity. Children are told that sexuality extends from cradle to grave. This is not necessarily in the draft as it stands, but I feel obligated to let you know what could be ahead of you if the draft is passed. They tell young people that sexual expression is a human right, and that early sexual activity and multiple partners and high-risk behaviors are normalized. An attitude of openness and adventure is celebrated. But of course, these are the very behaviors that fuel the epidemics of genital infections, unwanted pregnancies, abortion, and emotional distress in this country, whether or not a condom is used. Young people who practice the lifestyle that's promoted by comprehensive sexuality education have more doctor's appointments, not less. And that is so for a simple reason. When sexual freedom is the priority, when kids are given a green light to go out and to become sexually active, that's what they do. That's what they do, and their sexual health suffers. You don't need a PhD in public health to understand that. All you need is common sense. These problems are not abstractions to me. I'm reporting to you from the front line. For the past 30 years, I've seen a steady stream of people come through my office who were suffering from the sexual decisions that they made. Their suffering was 100% avoidable. To make matters worse, there wasn't much I could do for them because it's after the fact. I have lost count of the number of patients I've seen, most of them girls and young women, who've been diagnosed with a sexually transmitted infection, or they were terrified that they might have HIV, or they were simply confused and upset after hooking up with a guy a few times, and then realizing that an emotional attachment was the last thing that he wanted. Often when I explain to these students the science that you're about to hear today, they'd say to me, Dr. Grossman, that makes so much sense. Why didn't I know that? Why didn't anybody tell me that? Well, these were good questions, and I began to wonder, if girls are so vulnerable, especially girls, vulnerable to sexually transmitted infections, or how they're wired, both girls and boys are wired to attach emotionally through intimate behavior, why doesn't that science reach young people? Why don't they know about it? They know all about diet and trans fats and sugar. They know about heart disease, cholesterol, osteoporosis, breast cancer. They know so much about so many health issues. Why is there an ignorance about the consequences of intimate behavior at the wrong time with the wrong people? These questions led me to write the book, Unprotected. Unfortunately, we don't have this book for sale here today because this event, I don't know if you're aware, but this was all done like within 7 days, 7 to 10 days. And so we were in a big rush. We weren't able to get everything. But this book was my first book. And in it, in each chapter, I describe a patient who came to me, to my office, and how he or she was harmed by the sexual ideologies and omissions of biological truths in sex education. The students that I wrote about in this book made a lasting impression on me. They turned me into an activist. And that's why I'm here today. After Unprotected, I went deeper into what's taught in sex education, especially the websites and the books that are recommended to adolescents. And as a physician and a parent and a grandparent, I just couldn't believe what I saw. And so the second book that I wrote is called You're Teaching My Child What? And we do have that one there for sale. For the past 10 years, I've been studying sex education, how it began and what it is now. I was astonished to realize that sex education is actually a social movement. It's not about health. It's about changing society. That was the case 50 years ago when it began, and it is still true more than ever. Sex education is not based on the world as it is. It's based on how a group of activists believe the world should be. It's based on a dream, a vision of the perfect world. According to that vision, there are no substantial differences between male and female. If such differences exist, they're not inborn, they're not eternal. They're due to forces within society against which we are obligated to struggle. In this ideal world, no particular lifestyle is healthier than another. Chlamydia, herpes, HIV, they infect people in a random manner. They are equal opportunity diseases. You could call this the Marxist approach to sexually transmitted diseases. This vision appeals to many people because, after all, why should girls pay a higher price for promiscuity than guys? That's sexist, that's not fair. Why should certain sexual encounters be more dangerous than others? That's homophobic, that's not fair. But this is a made-up world. It doesn't exist in the real world. The differences between male and female are vast and permanent. One of these differences is that girls have unique biological sensitivities, and early sexual behavior endangers them more than boys. That's not sexist, that's something that you see under a microscope. And any sex education program that claims to be medically accurate and up-to-date and comprehensive has to include that information, and I'll give you more details in a few minutes. Furthermore, certain behaviors and lifestyles are 100% risk-free, while others are treacherous. In the real world, an abortion is devastating for some men and some women. It's a wound that they carry with them their entire lives. These are all indisputable facts. There's no debating them, but when these facts challenge the sex educators' vision of this perfect world, they're omitted from sex ed. If what's seen under the microscope threatens the dream they have for society, it doesn't exist. And that's why I contend that due to this ideology, and as a result of these omissions and distortions, young people, especially young women, are being sacrificed on the altar of political correctness. So like I said, comprehensive sexuality education, the priority is sexual freedom, not sexual health, and you can't have it both ways. Now let's get into the draft. In 5th grade, kids are told that the most common way for someone to get bloodborne pathogens, for example, HIV, AIDS, hepatitis C, is to participate in high-risk sexual behaviors or share a needle with another person who is infected. We don't know what is the definition of sexual behavior. Now, you may think that's kind of an odd question, but actually, once you've studied these curricula like I have, I can tell you that in some sexuality, comprehensive sexuality programs, sexual behavior does not include showering together or mutual masturbation. Sexual behavior would only include in some programs the exchange of bodily fluids. Now, you and I know that that leaves a whole host of activities out there that would not be considered sex, that would not be considered dangerous. And we want to make sure that these definitions are clear in the programs that we're going to present to kids. Words are very important. So what does sex mean? What is sexual behavior? And what is high-risk sexual behavior? Generally, comprehensive sexuality education only considers high-risk behavior to be sex without a condom. And this is very, very important because we know now, we may not have known in the 80s, but we certainly know now that many infections, in fact, the most common ones, the viral infections like genital warts and genital herpes, they occur on skin that's not even covered by condoms. So even though it is better to wear a condom than not, it's not fair, it's not accurate, it's not comprehensive to tell kids that only unprotected sexual behavior is high risk. Now, furthermore, kids are told in 8th grade, anyone can get an STD or HIV regardless of their age or sexual orientation. And this goes back to what I was talking about this kind of equal opportunity, sort of Marxist approach. And I know that you've had here some billboards here in the city showing, what is it, the homecoming queen, and the president of the science club, something like that, and on this billboard it says, you know, I'm the president of the science club and I have an STD. I'm the homecoming queen and I have an STD. Leading people to believe that these things happen at random. And that is simply not true. Certain people are more at risk, and that's what I want to get into now. First of all, adolescent girls are much more susceptible to sexually transmitted infections. And that is because the cervix, which is the entrance to the uterus, the cervix in a teen girl, the center of it is only covered by one layer of cells. And as you can see here, I can walk around, right? So this is called, this area that's outlined in yellow, I don't know how well you can see it, but it's called the transformation zone. And what it looks like in an image, in a girl in her teens, and the younger she is, the worse it is that area is only covered by cells like this. As she gets older and more mature, her cervix matures. And that area develops its own protection, so to speak, and it becomes covered with many layers of cells, so that sexually transmitted infections have a much harder time getting through this barrier than they do this. It's much easier, obviously, to break through this one layer of cells than it is this thick layer of cells. Now, this right here is something that we've known about in medicine since, I don't know, maybe the 60s or 70s. But somehow this doesn't make its way, and this is hardcore science. This is no one's opinion. This is not a theory. This is not an ideology. This is the biology of adolescent girls. And this is what an adult cervix looks like, and this is what an immature cervix looks like. So a young woman can go in to her gynecologist for an annual exam, and the doctor can actually see that area, that orange area, and can notice from year to year as it's getting smaller. There are various factors that can prevent the cervix from maturing quicker. Two factors are smoking cigarettes and being placed on birth control pills. So when we place young girls on birth control pills in order to prevent pregnancy, we may inadvertently be increasing the risk of her contracting a sexually transmitted infection because it will delay the maturation of her cervix. Now, in my opinion, if we're going to be introducing these ideas to kids in the 5th grade, 6th grade, and 7th grade, these kind of pictures need to be front line and center. And girls need to know that when they become sexually active with guys, they're more at risk from having sex than the guy is. They're more at risk for suffering as a result of the sexually transmitted infection. And I'll talk more about that later. And as I said, we've known about this for a long, long time. This is from the CDC, the Center of Disease Control in Atlanta. Sexually transmitted diseases pose a severe threat to women's and girls', obviously, health and fertility. Biological factors place women at greater risk than men. When we don't warn girls about this, we are withholding critical information about their health and well-being. Furthermore, girls, the developing brain of a young woman is more sensitive to depression and stress, especially following a failed relationships. And it's not as if we need like double-blind, $1 million study. Like, we know this. We know this anecdotally. We know this just from being, from having lived life. We know that often, not all the time, I'm making a generalization, but often girls are more sensitive to a breakup than guys are. And we know now that the brain is partially is sensitive with the surging hormones, and girls need to be aware of that as well. In the 7th grade, the draft plans on telling kids that sexual abstinence is the decision to refrain from vaginal, oral, and anal sex. Well, if you're going to be introducing those terms to 7th graders, and I'm not sure that that should be done. I think it should be up to the parents. I think the parents should be deciding, do their kids need to know about all this? But if we are introducing it, you see, when this is placed in front of kids, they're led to believe, the implication here is that all these activities involve the same degree of risk in terms of infections, and that is completely untrue and medically inaccurate. I'm going to compare for you now, this is the biology of the vagina compared to the rectum. So we're comparing vaginal intercourse to anal sex. The vagina is constructed in such a way that its lining is 20 to 45 cells thick. It has a lot of elastic there. It allows for stretching. I mean, it's designed for a huge 10-pound baby to be able to pass through there, so it's designed in that way. There's natural lubrication. It has a low pH, which actually inactivates the HIV virus. And the mucus in the vagina has proteins that fight HIV. The rectum, on the other hand, the pH is higher, which is more friendly to HIV. The lining is only 1 cell thick. The lining of the entire gastrointestinal system, and then as a consequence, of course, the rectum, is only 1 cell thick. And it's easily torn. There's very easily micro tears. There's no elastic, there's no natural lubrication, and there's a certain kind of cell in the rectum called an M cell. And those cells actually take the virus, the HIV, the human immunodeficiency virus, and bring it in to this body, bring it into the system, the exact opposite of what we want to do. We don't want that virus to get into the lymphatic system, and those cells bring that in. Now, this is a lot of hard science. I don't want your eyes to like gloss over here, but this talk is about hard science. This talk is about being medically accurate and comprehensive. So now you know why anal intercourse is at a minimum 30 times more dangerous than vaginal intercourse for the transmission of HIV. And that number comes from the New York City Department of Health, which is not a bastion of conservative thought. Okay, anal intercourse is much more dangerous by a huge factor than vaginal intercourse, regardless of whether a condom is worn. Now, getting to condoms and anal sex, this used to be, until about 1.5 years ago, on our FDA website, the Food and Drug Administration website. The reason why the Food and Drug Administration deals with condoms is because condoms are considered a medical device. So they're responsible for the efficacy of medical devices. So it said on the FDA website, and it said it since the early 80s, right? Some of you will remember President Reagan's Surgeon General, C. Everett Koop. And this was at the time that AIDS was first coming out in the early 80s. And he stated that condoms provide some protection, but anal intercourse is simply too dangerous to practice. Condoms may be more likely to break during anal intercourse because of the greater amount of friction and other stresses involved. Even if the condom doesn't break, anal intercourse is very risky because it can cause tissue in the rectum to tear and bleed. These tears allow disease germs to pass more easily from one partner to the other. This was on the FDA website for over 30 years. And then it disappeared. Now I ask you, did biology change? Did physiology change? Of course not. What changed is the culture. The culture is changing, and certain behaviors that in the past people would be very seriously warned about are now being presented as if they carry no more increased risk than other forms of sexual behavior. And this is flat out incorrect and flat out wrong and unethical. We're so careful about warning kids about, drinking and cigarettes and high-fat foods and sugar. But when it comes to anal intercourse, one time, and you can have HIV. And I do know somebody that, out of ignorance, participated in that behavior. And she did get HIV and now has AIDS. One time, folks. So I don't think that it's an exaggeration to say that when we withhold this information from young people, we are withholding life-saving information. This is the kind of stuff that makes me really mad. And it should make you mad also. These are our kids. Now, in the 6th grade, kids are told in the OPS draft, unprotected sex or shared needles with an infected person are the most common ways for a person to get an STD. That is not so. The most common STDs are the human papillomavirus, the one that causes warts and, in rare cases, cervical cancer, and genital herpes. Like I said earlier, those viruses live on the skin, and so whether a condom is worn or not has little or almost no effect on the transmission of those viruses. So again, we're telling 6th graders that unprotected sex is the most common way for a person to get an STD, so that person's going to go out and use a condom and think, you know what, I was good, I used a condom, nothing bad is going to happen to me. Every health provider in this country has seen people who have said, with STDs, who have said, I don't understand, we used a condom every single time. This gives kids a false sense of security. If anything, we want to scare kids. We don't want to go on we don't want to give them a false sense of security. I have no problem scaring kids in this area. And by the way, a good way of scaring kids, if you have anyone in your life that you feel needs to be given a good dose of reality, go online and Google either HPV or genital herpes or genital warts support group. There are support groups online that are anonymous, and people who are infected go on there for the support and advice and just the feeling of I'm in a community, I'm not alone with this condition. You go on there and start reading. First of all, there's tens of thousands of people on these sites. Sit down with a young person, 10 minutes, just give it 10 minutes. Start reading through some of the entries of what people are saying about how devastated they are. They have herpes or they have genital warts. They don't know who they got it from. They don't know who to tell. It's painful, it's embarrassing, it's shameful. They're depressed, they can't sleep. They're wondering who's going to love them now. So I highly suggest doing that if you need to. And if I were putting together a sex ed curricula, that would for sure be part of it. I would just take the class in 6th grade, 7th grade, 8th grade, every year, and just hammer it into them. This is the reality of having a sexually transmitted disease. This is real life. This is the human papilloma virus that causes warts and rarely cervical cancer. It's actually a lot smaller than that. That's a joke. Now, in 7th grade, kids are going to be told young teens are not physically or emotionally ready for sexual intercourse or the potential consequences associated with it. Young teens are not? What about older teens? Well, look, in 8th grade, they're being told dating and romantic relationships can be a way to learn about other people, about romantic and sexual feelings, and about what it is like to be in intimate relationships. This is not what we want to tell 8th graders, people. And this leads me to what I discovered in comprehensive sexuality education is that parents and policymakers are told one thing, but then kids are told another thing. For example, there was an interview on NPR with the director of CSE, the Sexuality, Information, and Education Council of the US, which is a private organization and that is, along with Planned Parenthood, one of the prime flagship organizations of creating comprehensive sexuality education. So in this interview, the moderator asked the director of public policy, You would agree that it would be best if kids didn't have sex in high school, am I right? And he said, listen, absolutely. It is better for young people to wait to have sex. There is no question about that. But you know what? At the very time that he was giving this interview, if you went on to the CSE website, you would find this pamphlet for kids, Talk About Sex. And guess how it starts? At every point in your life, you can choose if and how to express your sexuality. Most sexual behaviors involve some level of risk. It is up to you, they're telling the child, it is up to you to determine how much risk you are willing to take. Are you kidding me? Being a teenager is all about taking risks. And we're telling them, you decide? Do we tell teenagers, sure, have some alcohol, get behind a wheel, you decide if you want to take the risk. Have some cigarettes, you decide if you want to take the risk of becoming addicted to nicotine. Of course we don't do that. So why is it okay to do this? This is Planned Parenthood, another flagship organization. And again, I don't know if Planned Parenthood is going to be coming into your schools or not, but it's a red flag. If you're having comprehensive sexuality education, there is quite a good chance that some of it is going to be influenced by Planned Parenthood. So Planned Parenthood on their website called teentalk.com asks the question, am I ready for sex? And they say, am I ready for sex is a question that only you can answer. So take your time and talk things through with your partner if you're thinking of taking this big step. Okay, I can tell you're getting it. You're getting it. Let's say you have a girl, she's 13 or she's 15, and she's hanging out with a guy who's a few years older or a lot older, and she's just not sure, is she ready for this big step? Well, I'll sit down and I'll talk to him about it. I'll ask his opinion. He knows best. I'm telling you, it's just unbelievable. More from Planned Parenthood. Some straight couples use anal sex as a way to preserve the woman's virginity. For those who like it, anal stimulation can be part of masturbation, intercourse, and oral sex. Okay, now I'm not going to dwell on this, but listen, people, they're saying that you see what they're saying here. I don't think I need to get into it. Now, all these things, these few slides that you've been saying, the reason that these things are said is because it's not politically correct to point out that girls are more vulnerable than boys, that young girls are more vulnerable, that anal sex is more dangerous, a lot more dangerous than vaginal sex. And in my profession, there's political correctness all over the place. But when you find political correctness in the health profession, when health information is withheld, or the consequences of STDs or sexual acts are whitewashed, or they're discussed in a casual way, without waving any red flags, lives are endangered. And I'm just going to emphasize here that, again, the goal is to change society, not to protect the health of our young people. It's to create a world in which each individual, regardless of age, makes his or her sexual choices and decides how much risk he or she is willing to take, and no judging is allowed. Parents aren't allowed to judge. Teachers are not allowed to judge. Counselors, doctors, no one is allowed to judge. Now, I want to speak for a minute about the teen brain, because this is information that's relatively new. It wasn't around in the 70s and 80s, but now we know that the teen brain is immature, and that the last area of the teen brain to mature is called the prefrontal cortex. It's right here behind the forehead, and it's like the CEO of the brain. Okay, it's the part of the brain that is very rational, and it makes rational, thought-out decisions, not quick, emotional, gut-level decisions. It thinks about the pros and the cons. How am I going to feel about this tomorrow? Is this a smart thing to do or not? Now, that area actually doesn't completely mature until the mid-20s. And guess who knows all about this? Car insurance companies. You have Allstate here, right? This was an ad that Allstate ran. I don't know if they still run it or not. But anyone with a teenager knows that your premium goes up when your teenager gets their license. And Allstate wanted to help people to understand that, to get that. So they created this campaign to educate parents. Why do most 16-year-olds drive like they're missing a part of their brain? Because they are. Even bright, mature teenagers sometimes do things that are stupid. Don't we all know that? But when that happens, it's not really their fault. It's because their brain hasn't finished developing. The underdeveloped area is called the dorsal lateral prefrontal cortex. It plays a critical role in decision-making, problem-solving, and understanding future consequences of today's actions. The problem is, it won't be fully mature until they're into their 20s. Now, this piece of neurobiology alone, without all the other things that I've told you and will tell you, this alone should be enough to justify a sex ed curricula that teaches kids, you are not ready. You may feel ready. That's part of adolescence, is that you feel ready for anything. And no matter how much we teach you about refusal skills and how to put on a condom and STDs and, where to go for, to get tested and how often you need to be tested and all that information and giving them free condoms and birth control, it's not enough, because the wiring, the circuits in the brain are immature. The wiring isn't complete. They're still going to end up doing stupid things. And when you have a teenager and they do something dumb, often they'll come and talk to you about it, and the parent will say, what were you thinking when you did that? And what do they say? I wasn't thinking, right? Because they're more inclined, and we can see this now on MRIs, and there's been a lot of great studies, that in situations of high stimulation, driving fast in a car full of your peers, or bungee jumping, or potential sexual encounters. Okay, these are high stimulation events, situations, and in that environment, the teen brain tends to regress more into the kind of gut level reaction, and to not use the part of their brain that's more grown up and more mature. We need to tell this to our teens. They need to be told not to wear a condom, but to try and avoid sexual behavior altogether, including situations that are very tempting. One psychologist studying the teen brain describes the teen brain as being more like Kirk than like Spock, okay? Kirk was the emotional one, who just he said whatever came into his brain, and, he was kind of impulsive and he would do things, and Spock, wait, did I get it backwards? No. Or Kirk? No, but Spock is the one. Oh, Spock? Oh, that's right. Oh, you're right. Okay. I'm not a Star Trek person. Right. And Spock is the one who would say, wait a minute, let's look at this and let's be analytical and let's consider all the different factors. So this came from a neuropsychologist, okay, studying the teen brain. This is not my words. This is what she said. Now, all these different factors, the teen brain, the immature cervix, and the fact that kids are actually, in comprehensive sexuality education, are actually being, to a certain degree, encouraged to explore their sexuality and to explore different lifestyles. It's because of all this that in this country, another young person is infected with an STD every 3.5 seconds. Now, I want to explain something else that's very relevant to you here in Omaha, because is it Douglas County where you have very, very high rates of chlamydia? And chlamydia and gonorrhea are bacterial infections that are very dangerous. When boys have them, they more often have symptoms, but girls are more likely to have silent infections. And in a girl, these infections will silently climb up the reproductive system and reach the fallopian tubes and cause a lot of damage. But what I want to mention here is that in the draft, 6th graders are told that STD caused by bacteria can be cured by antibiotics. Now, that's true, but only sometimes. And this is another example of giving young people a false sense of security, because the truth is that wait a minute. And here's another one. In 10th grade, kids are told untreated STDs can lead to serious health concerns, including infertility. But the truth is that also treated STDs can, and I'll explain what I mean right now. Okay, and again, it's girls that are more vulnerable than boys are here. So here's the female reproductive system. And chlamydia and gonorrhea, which are often silent infections, can go up into the system and reach the tubes, and the bacteria settle in these tubes, which, these are the tubes that the egg has to travel down here, and it would get fertilized. The sperm would come up here, and it would get fertilized usually somewhere around here. And what these bacteria do is that they settle in and create swelling, tenderness, sometimes some pain. And as the infection resolves itself, it causes scarring. And the scarring is going to narrow this very thin tube. It's already extremely thin. It's like 4 millimeters. So with the infection, it can further narrow it or completely block it. What does that mean? That means a few things. One, a woman later in life may have trouble getting pregnant because the egg may not be able to pass through the blockage and get fertilized. Or what could happen as well is that fertilization could occur, but then as the zygote, the fertilized egg, it begins to grow, and it tries to move down here to be implanted in the uterus. If it hits that blockage, it can't move any further down, and that's called an ectopic pregnancy. And that is a life-threatening situation. The zygote is growing over here, it's stuck, it's getting bigger and bigger, and eventually it's going to burst. That's a medical emergency. You really don't want that to happen. So kids are told that antibiotics can cure this is called PID, pelvic inflammatory disease. Very, very common problem in this country, and if your rates of chlamydia and gonorrhea are high in Douglas County, then PID is very, very high. And those women there are going to have trouble in the future. And I'll tell you what's not, you see, the problem saying that antibiotics cure this is that we don't know how long it takes for the bacteria to travel up here. It could take a week, it could take a month, it could take longer than that. Girls are told to get tested, I don't know what they're saying now, once a year or twice a year or whenever they have a new partner, but let's say a girl is sexually active on January 1st. She gets gonorrhea or chlamydia, and then she doesn't get tested until, I don't know, June, September. The damage is done. The damage is done. If she gets tested, soon, and it catches it before the damage occurs, yes, you could say she's been cured. Although even that is not 100%. I won't go into all those details, but these diseases are very nasty, and they're very clever, and it's just not as easy as, wear a condom, get tested, get antibiotics, and you're out of the woods. It's not that simple. Okay, here's chlamydia showing how it's gone up since 1995. And it's highest in females, I'm sorry. That upper line there that's going up is in females. Okay. And not only that, but the CDC is now telling us that untreatable gonorrhea is on the way because there's so much antibiotics that are being used on gonorrhea that the bacteria is becoming resistant to all the antibiotics that we have. And you know about this. You know that you have to get a flu shot every year because you have a new strain of virus that occurs and that there's mutations in the virus or the bacteria, and they're very clever. These bacteria are very clever, and viruses, and they develop resistance toward the treatments that we have. So again, kids are being given a false sense of security. So the CDC says bacteria are developing resistance faster than we're inventing new medicines to fight them. The threat of untreatable gonorrhea is emerging rapidly. Where is this information in your draft? I believe that if this is instituted, information like this is never going to get to your kids. And this is syphilis, another horrible disease that was almost eradicated many decades ago, but is now coming back, and it's coming back especially in the gay population. And here, that dotted line, the upper one, is in males, and they are, by and large, males who have sex with other males. One thing that's important to know about, I've probably gone too late, and I'll do this very fast, but this is another thing that's up-to-date, cutting-edge, medically accurate science, and that is the biochemistry of attachment. We now know that intimate behavior is not only about pleasure, that we react, men and women both, react to intimate behavior, to sexual behavior, and even to a prolonged, nice, long hug, that we have certain hormones that are released that affect the brain. And primarily the hormone that we normally talk about here is called oxytocin. The brain releases it. A hormone is a molecule that travels from one organ to another with a message. And oxytocin has all sorts of possible messages that it can send. It sends the message in a nursing mother. It sends the message to release the milk, for the milk to come down for the baby. When the mother's in labor, it sends a message to the uterus to contract and expel the baby, but we also know now that it acts on the brain and that it shapes the circuitry of trust in humans. And in fact, there are very interesting studies that are done that involve giving people a whiff. You can inhale oxytocin because it's made synthetically. You can actually buy it online. It's rather expensive, but you can buy oxytocin. It is used in disorders, for example, in people with Asperger's syndrome, which is a form of autism. They have trouble relating to other people. They have trouble trusting people and making eye contact. When they're given oxytocin, which is the relationship social molecule hormone, they do better. They're more trusting. They look you in the eye more. And this is the hormone that's released in men and in, well, men have another hormone, but in general, this is the hormone that's released during intimate behavior. And this is why so many young women come into my office and they have become emotionally attached to the guys that they have been hooking up with casually. And they come in and say, Dr. Grossman, I don't understand. I'm just hooking up, you know, it shouldn't mean anything. Why am I always thinking about him? Why am I always waiting for him to text me? Why does it matter to me if he likes me or not? And then I explain this whole thing, oxytocin, you have sex with someone, you're intimate with someone, you know, you're lying next to him, you're inhaling his pheromones, there's all this chemistry that's going on. This is how we are designed. We're designed to bond during intimate behavior. And when you're with someone in a long-standing, trusting, committed relationship, AKA marriage, oxytocin is fantastic because it's glue. It's glue with the other person and you want that. But when it's a casual thing and a one-night stand, well, they're not called that anymore, but a hookup with a stranger, you don't want that oxytocin thing going on. You don't want that glue, but it's gonna happen. It's not under your control. So oxytocin switches love and trust on, and it switches caution and aversion off. And this is why so often, you might, people get attached to partners that they really didn't like in the beginning, but slowly and surely they become attached to them. And it's kind of hard to get it because like, she's a jerk or he's a jerk. Like, what does this person see? And it's like the glue that's happening there. And it's a powerful thing that young people need to know about. I think I'm going over time. I'll just say one thing about gender stereotyping, which kids are going to be told in 6th grade. They're going to be told that it's because of society that male and female have different behavior patterns and different likes and dislikes, and girls like dolls and boys like cars and so on and so forth. But science in this century is showing that many of these differences are biological. And in fact, the male and female brain begin to be different at 8 weeks. 8 weeks post-conception is when you already begin to see differences in the male versus female brains. Furthermore, there are fascinating studies that have been done with monkeys. Okay, like in this study right here, male and female young monkeys were given a choice of toys to play with, either dolls or things with wheels, vehicles like trucks and cars. Lo and behold, the female monkeys picked the dolls, and the male monkeys liked the action toys and the movement. So I'd like to ask, are there gender stereotypes in the animal kingdom as well? This is the sort of information, this is medically accurate, this is comprehensive, but because it goes against the social agendas of these sexual education programs, they are omitted. Now finally, I'll say this. In the 7th grade, kids are told, there's a standard for the 7th grade. Describe ways to show courtesy and respect for others when their views are different from your own. And I want to ask if OPS itself is practicing what it preaches. Because they have this entire draft about sexuality. And I think I'm going to venture to say, and I think it's fair to say, that a good number of families that will be involved with this, whose kids will be taught this sex education, a good number, if not a majority of families, are families with strong faith who want to follow the Ten Commandments and who want their kids to wait until, not only until they're adults, but actually until marriage for sexual behavior. And the word marriage is not even mentioned once in here. So if Omaha Public Schools really is going to show courtesy and respect for those with views that differ from theirs, they would at the very least describe that in here and say that there are, there are huge or there are significant percentages of families that believe that sexual behavior belongs within marriage. So, I'm just going to wrap up by saying that I was interviewed a few years ago, and in that interview I was told that I must be exaggerating, that it must be hyperbole when I say that sex education is madness, and that it teaches untruths to children and exposes them to smut. If that's true, I was asked, wouldn't there be congressional hearings? Well, I'm not exaggerating. From my perspective, having taken an oath to prevent disease whenever I can, the principles of sexuality education are madness because their vision promotes sexual freedom. And when sexual freedom reigns, sexual health suffers. Is every young person going to postpone sex? Of course not. I don't live on the moon. Of course not. But we are still obligated to inform them of the grave risks that they face, to teach them the biological truths about their physical and emotional vulnerabilities, and to warn them in a no-nonsense manner about avoiding high-risk behaviors. That is what we do in every other area of healthcare. But when it comes to sexuality, kids are being taught that they can play with fire. And the waiting rooms of doctors and therapists are filled with people who have been burned inside and out. I urge all of you in this room to condemn these dangerous messages and forgive me, but I must say to those on the OPS board that will vote to move forward and adopt this draft, thereby opening the door to the entire ideology of comprehensive sex education, I think your intentions are good, but I believe that your minds and hearts are shutting out the truth. The biological truths that I have discussed today and many more. And for that reason, I must say, shame on you. We must teach students that sex is an appetite, a healthy and wonderful appetite. The urges are normal and healthy, but acting on them at this time in their lives is not. They must understand that sex is a serious matter, and what they are seeing on TV and at the movies is fiction. Science affirms the age-old wisdom of restricting sexual expression to marriage. Tell students that the pain and anguish of STDs are 100% avoidable. It's all in their hands. They can do it. Please educate yourselves. please go to my website. There's lots and lots of information. You can download all sorts of things for free. I also am on Facebook, and I would appreciate if you would go onto Facebook and like me on Facebook, and I'm also on Twitter. There's a lot of work to be done. It's not easy to speak about these things, but the stakes are very high. And we don't want the young people of Omaha, the young people of Nebraska, to come back to us in a few years and say, why didn't I know that? Why didn't anybody tell me? Thank you so much.
Thank you so much, Dr. Grossman. We're going to gather up the cards. If you have any questions, we'll just take a few, maybe 5-10 minutes here to do some questions. Remember Dr. Grossman's book. I highly recommend it. I've read it. It's well researched, easy to read. We have it for sale over there for $20. And you don't have to pay shipping and handling that way. So please avail yourself of that opportunity to read this book. It's very eye-opening and a lot more information than what she's able to share in just a short time with us. Again, we'll be gathering these questions, and I have some already that ready to ask her here, and we'll get the rest of them. Again, we're not going to be able to go through all of these, but let's start with the first one here. You've been around the country and around the world to talk about the dangers of comprehensive sex education. What is happening in other places? What are parents and community members in other places doing to keep this away from their children?
What's happening here, in your community, this sort of grassroots uprising and outrage is happening all over the country, all over the world, in fact. So that's why I get to travel so much. I was in Toronto a few months ago, and the parents there are so outraged that they actually boycotted the public schools. They kept their kids home for a month. So, parents are definitely fighting back, getting educated, fighting against the boards, the Department of Educations that are promoting all this stuff, bringing in the science, bringing in speakers, changing people's minds. Sometimes we do well, and sometimes, this stuff is just bulldozed in. It's just pushed in spite of the desires of the community, which is very, very disturbing. Very disturbing. Parents are fighting it. They're learning. They're getting educated, and they are looking at opting out of these programs and getting material and doing it on their own at home, which really is the best place to do it. And I do want to tell you about an organization that has some wonderful material. It's called the Medical Institute for Sexual Health. It's in Austin, Texas, and their website is medinstitute.org. Medinstitute.org. It's MISH, for M-I-S-H, but the website is MedInstitute. And they have wonderful material. You could get together with a bunch of families and invest in it. They have videos, they have learning materials, pamphlets, all sorts of great stuff about how to teach your child this type of material, how to emphasize the risks, be medically accurate, give them a strong, no-nonsense, medically accurate message of restraint.
Okay.
The name of that again?
Yeah, it's called the Medical Institute for Sexual Health. It's based in Austin, Texas, and their website is medinstitute.org. And there's many others as well. I don't mean to say that there aren't many others, but that's just one that comes to mind.
Let's just do maybe one more question, because then we need to move to Dave Meyer talking about an action plan for what we can do then to keep this from happening, and what's coming up on Wednesday, which is the OPS board meeting, where they are going to vote on this. Here's the last question. What should schools do to deal with a situation with a transgender student? Many parents are concerned that that student would be in other words, like in the bathrooms with the girls, or vice versa, whatever the, what should schools do? I mean, what can parents do about all that?
The child who struggles with gender identity is suffering. It's a disorder. It's an extremely rare disorder. I believe it's going to become more common because it's now being celebrated, and there's a lot of like copycat sort of things going on. But the true case, of a child that has this problem, they deserve our sympathy and our understanding, and in my opinion, they deserve treatment that hopefully will help them become more comfortable with their biological sex, hopefully. But at the same time, I don't believe that an entire school has to be turned upside down for the needs of one or two kids. And, it would be as if, there's a child who's, say, has diabetes, or cerebral palsy, or conditions which are actually more common than gender identity problems. As if we would, if we had a child who's on a very strict diet because of diabetes, and then we said, well, the entire cafeteria is only going to be diabetic food, because all the other kids, that child is going to feel bad. That child is going to feel discriminated against. That child is going to feel whatever. So therefore, everyone has to change, what they eat. It's simply, it's not feasible. It's not fair. It doesn't make sense. And these places where, biological boys are coming into the girls' changing rooms and showers and want to, and are insisting that it's their right to be there. This is just insanity.
On that note of insanity, which is,
Thank you, everybody.
Thank you so much to Dr. Miriam Grossman. Like she said, we did a flurry of activity and we wanted to get her here, and she adjusted her schedule to come and be with us.